Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the July 8th media availability. Thank you for being here with us.
Hi.
Today we have a lot of questions about the OptumServe testing site at Redwood Acres, so let's get started. The OptumServe website is currently not taking appointments at the Eureka location, although Optum staff say that they are operational. How does the website operate? Are staff at the location also operating the website, or can you elaborate on how appointment setting is coordinated for each site, including the field locations, which Optum visits periodically in Willow Creek and Southern Humboldt?
Sure. So Optum is becoming increasingly challenging, and I get that both for residents and for us working with it. Again, this was a service that the state has contracted for in counties, on behalf of counties across much of California. Again, when we began with Optum, and we were, there were very few counties who were using this service, our turnaround times were excellent. They have certainly grown, and as we mentioned the other day, not uncommonly, we're seeing 6 to 8 days in a turnaround time, which is clearly not acceptable. The scheduling for this site is that the Optum controls the scheduling, the online scheduling. They only release appointments 2 weeks in advance. And so it is not that there are no longer appointments in the foreseeable future, you just can't access them. And we are in conversations with them, as are other counties, to try and change that system. So it's important for people to remember that if they're symptomatic, if they're concerned that they've been exposed in a particular way, it would be best to reach out to their healthcare provider. If they don't have a healthcare provider, they can certainly reach out to us for assistance in that regard. If people are asymptomatic, and we've been asking people to come in and get tested in that way, we still would like that. But if it's simply for surveillance purposes, at this time, we are probably going to be having more difficulty getting you in quickly to get that testing done. And just a note that we are endlessly working on increasing capacity. We've ordered some additional equipment for our lab to increase capacity that we're waiting on, and looking at other options for restructuring this type of testing that's currently offered through Optum into perhaps some other entity.
Last week, the Optum Serve site was down due to a staffing problem, according to a staff member at the site. Can you elaborate on what that problem was, and if it was related to the issue of missing tests brought up recently, and if and how it has been remedied?
Yeah, actually, that really was a staffing issue due to illness in staff. And so that the problem is there is not a lot of backup capacity in that staffing within the Optum system. And so that clearly impeded our progress for a day or two. It has nothing to do with missing tests or performance of people in their role.
People are reporting problems booking a test at Redwood Acres. Available appointments are weeks out, and reports from LHI Care customer service that the site is at overcapacity. Can you talk about how appointments being booked solid will impact results, and where are other places residents can go get tested, and what is public health doing to improve access to testing?
I think we covered that in the previous question. I did note, though, that the first question did reference Willow Creek and Southern Humboldt off-site. Optum is the entity for the testing that we did in Southern Humboldt. And again, the scheduling operates exactly the same way. For Willow Creek, that actually is a Verily site operated by Trinity County, and may operate very similarly, but I don't know their mechanics. We refer people to Trinity to get scheduled.
Thank you for following up on that. Earlier this week, you said there were testing delays for the Redwood Acres site. Now they are no longer taking reservations. Overall, how is it working out, in your opinion, with the Optum Serve site?
Well, and again, I think we addressed much of this. I would simply say that as we're looking forward, certainly Optum has provided us with lessons about what's most desirable as we select future sites. This has been a perfect gift for us for quite a long time now, both in terms of its start to finish, sort of inclusive procedure for gathering, billing, and getting the test results to us. But, as the testing pressure increases across the country, all of these large labs are being put under a strain, both by the demand for the tests and the shortage of reagents and testing supplies. So this is not something being just felt in Humboldt. This is something being felt pretty universally. And all I can tell people is that we're doing the best we can to sort of maximize what we can do locally in spite of these limitations, but it's a frustration universally.
Thank you. OptumServe is not accepting new appointments for the next 3 weeks, and their testing results take a week to arrive. This would seem to take our testing capability back to the days before OptumServe, when people needed to have medical reasons to be tested. We don't have surveillance capability anymore.
Well, I would argue that we do have the surveillance capability. It's, people may not be able to get in the week that they want to, but again, their appointment availability is out there 2 weeks from now. But it's certainly correct that, a turnaround time like that reduces our ability to use it even for things like contact investigations, testing contacts who have not had symptoms yet, that type of thing. So it is a big limitation. And as I said, it's a work in progress.
There have been several questions surrounding the disproportionate rates which minorities in the county have contracted the virus at higher rates. Have public health officials looked into why? And please explain the severity of conditions the virus has imposed on races more clearly.
So yes, we've certainly reported that for our community, we've seen a disproportionate disease burden in the Latino community. This, of course, has been seen throughout the state, as well as in other communities of color, such as the African American community. I think that when we look at this sort of through a social determinants of health lens. I think there are access issues for many minority populations. I think that there are potential language barriers in accessing information and services for populations. I think that in populations who are working more on frontline service jobs, jobs without necessarily associated health care and benefits, can impact people's ability to access health care. So, and then I think there are just culturally, in terms of communities and how they communicate and interact with, again, healthcare system, public health, that type of thing, there can be barriers. So I think those are issues among many communities now.
Thank you. A few weeks ago, during an interview, Dr. Frankovich mentioned, frankly, we might have to walk things backward if the virus continues to increase as it has. Has this topic been discussed any further?
Well, I would say that we discuss this every day. Every day we look at our data and our indicators. As people are aware, there's a county monitoring list where the state is also looking at some of our indicators. And we're looking at that specifically to see what the landscape is and whether there's any correction needed in our course. Obviously, we don't want to have to step back, but as other counties in the state have seen, sometimes that's required because of a very rapid increase in cases. And certainly when people are in a phase where they're seeing increases also in hospitalizations, both general and ICU. So, this is a really tricky virus. It really, as we've mentioned before, can circulate kind of in gradually increasing levels before it really breaks through and begins to infect populations, older populations and such, that end up requiring hospitalizations. So early on, we look at case counts to tell us how we're doing. As this progresses, we'll be looking more and more at our hospital and ICU capacity. And again, we're vigorously trying on our contact tracing so that we can limit what transmission there is out there in the community right now.
In the past, you've mentioned how our total case count reflects Humboldt County residents that have contracted the virus. Can you confirm that people who do not permanently reside here, but maybe have been tested here or are living here part-time or temporarily for whatever reason, are not being included in the total number of cases? And if that's the case, then how many positive cases have actually been reported in the county in comparison to the number publicly reported by public health?
Well, I would say that until recently, it's been very infrequent. I mean, I would say probably a handful of cases, not a lot, that have been individuals who do not reside in this county but happen to be tested here because this is where they became ill. However, I would say also that just in these last days that we have seen an increase, again, as I've mentioned, because of gatherings, family visiting the area and exiting the area to visit, we have seen some increase in positive tests in out-of-county people who are here. We, in fact, we will be reporting today six positive tests today that are in out-of-county residents.
With a spike in the local cases, is the county yet considering rolling back some of the 2,100 businesses that have been allowed to reopen, including gyms, family entertainment centers, casinos, or movie theaters?
Well, again, as we mentioned previously, we review all of this and what our indicators look like every day. Right now, we certainly do not fit the bill in terms of the state's guidance on rolling those things back. Certainly that involves 3 days on that county monitoring watch list from their perspective. One thing I will point out is that with the county monitoring data that the state has, that really is looking at 14 days in many of these instances, and we are able to look at that in more real time. So there may be a point at which we're seeing trends that are really worrisome and suggest that that's important to do. We just have not hit that point yet.
Back when this started, an expanded testing capacity was one of the key things we needed to have in place for local control over our reopening schedule. What does not having that capability mean for us now as we are more or less reopened?
Well, it's really important to be able to have robust testing capacity, both to do the things we want to do on a regular surveillance basis, but also to be able to respond to increasing numbers of cases. So with Optum being problematic, it's an issue. Luckily, in our internal lab, we are not really faced with the shortage in supplies that some people are at this time. But it does impact the supplies that some of our clinics and hospitals are able to use for testing. So, whereas I think in the right conditions with complete guaranteed availability of all the reagents that we need to do tests, we can mount pretty good capacity even within our county without a site such as Optum. In light of the limitations and possible ongoing limitations of reagents, that is not yet the case. And so we're really, again, having to be really prudent about how we prioritize testing as we are going through this piece in the path where we're finding some limitations.
We've received word the California Department of Corrections and Rehabilitation is planning to release a number of inmates who have been exposed to COVID-19 back into Humboldt County this month. What is the county doing to ensure these inmates will be returned to Humboldt County in a manner that is safe for them and the larger community?
Well, the process established by the Department of Corrections and state public health is that local public health is notified when an individual who is either tested positive and requires ongoing isolation or has been possibly exposed and needs quarantine is returning to the community. Then public health works with probation and parole to ensure that these individuals have a place to stay when they return for that period. And then when they complete that period from public health standpoint, they are released and then followed up as they routinely would be.
You mentioned at yesterday's board meeting that roughly 100 people in Humboldt County are under quarantine due to possible COVID-19 exposure. How many contact investigators does Humboldt County currently have, and is there a fear that caseloads and contact could eclipse capacity in the near future?
Well, we've been able to continue to build our teams, and I believe at present we have nearly 60 individuals that are either fully trained or are completing training, getting onboarded to being able to assist with these investigations. However, that being said, what I can tell you is that each case can engender, dozens of contacts, and the work involved in reaching out to not only every case, but to each of their contacts, and then as those individuals become ill, reaching out to their contacts becomes an enormous undertaking. And I would tell you that we're doing fine right now. We are able to manage these cases at our current capacity, and we have room to increase our caseload, but we will never be in a position to be able to manage outbreaks in large scale events, for instance. An event that is, a couple hundred people, 500 people at a time where an exposure may occur becomes quickly not feasible. And so, again, we are as well prepared as we are. We are not in a position to be effectively doing contact tracing and investigation for gatherings. And again, it is a trend that we're seeing now. Even gatherings of 10 to 20 people can engender multiple additional cases and hours of contact investigation time. So I'm asking again that people are helpful in this regard, minimizing these contacts, preserving those resources. And let's face it, right now with testing challenges as they are, getting every individual who is exposed in a case tested promptly, perhaps tested more than once during their course, is challenging already. If we increase those numbers substantially, it only becomes more so. Our goal is not to have no one become ill. Again, we know that people are going to become ill as we mix. Our goal is to minimize the speed at which we're increasing this caseload. And that purpose of that is to preserve our healthcare system so everyone gets the care they need when they need it.
Excellent, thank you.
Thank you.